Well, Dr. Shannon, let's talk about a particular phenomenon in the mouth. People get gum disease. They don't brush, they don't floss, they don't go to the regular cleaning, and, all of a sudden it develops, a more heavy gum disease. Now, here's what I hear dentists always saying. When that happens, a year, 2, 3, whatever, or, as it progresses, different for all people, you will lose your teeth. And that's kind of like the major why you shouldn't have gum disease. Now, I happen to look at it a little different, and you tell me how off the rail I am here. If a person has a gum disease, which makes him eventually losing his teeth, well, of course, losing the teeth is bad. However, you dentists with implants and with all kinds of things, you're doing a heck of a job to put those teeth back in it, rather almost natural, beautiful looking, maybe even more beautiful looking because they're shaped the way they're supposed to be shaped. So anyway, yes, it costs some money, but you can do it. But here's what I see. While this process is happening until you lose your teeth, never mind that you now have to spend some money, which is stupid, but you're having an infection in your mouth. You're having that yellow, reddish, ugly buzz right there in your mouth, which happens to be the gateway of the blood vessels. And you're poisoning your body. You're poisoning your liver, your kidney, your heart. It goes to the brain, your blood in the veins. It's unbelievable. People have been known to get premature babies. Women who are pregnant, all kinds of things. Now, wouldn't that particular thing be much more devastating than losing your teeth? Even if we wouldn't have implants, if we only have dentures, which is, not that comfortable to wear and not that beautiful and has all kinds of other side effects, but even if it would be, the technology would be that bad, wouldn't still be the infection the really thing, how you actually kill your body, get fatigue, get tired, push your immune system down? Tell me, am I way off here or what's the deal?
No, Helmut, you sounded like a researcher coming out of one of the universities, because that's exactly what they've found, and that's exactly what's going on, and that's exactly what the medicine and dentistry is trying to get across to the patients. Instead of watching all these car commercials, it would probably be good on TV to see some of the information that you were just saying, because so many people don't know this, and it's really amazing. The mouth is the gateway, and unfortunately that gateway is filled with infection. Even in a healthy mouth, there's a huge amount, as you know, a huge amount of bacteria that's in there. And as soon as the gums start to become inflamed, the beginning of disease is inflammation. And as soon as that happens, boy, it's in your bloodstream. And if you're healthy, you can fight it on a chronic basis. But 3 out of 4 adults at the age of 50 or older in this country have gum disease, and 3 out of 4 adults have some form of heart disease. So there's a correlation right there. It's the same bacteria that's in your mouth that's in the inside of the vessels of the heart. It's the same bacteria that's causing liver inflammation. It's every one of those things that you said, the immune system being attacked, the brain, it's all there. And it's something that can be so easily taken care of. It's not even a matter of taking a pill for it. It's a matter of basically taking care of your teeth 2 times a year. Showing up to the dentist and getting them cleaned on a regular basis and taking care of them at home on a regular basis. It would just resolve all of those issues to begin with.
And
so you're absolutely right.
And if one has it, well, then you might need what you guys call a deep scale cleaning, which is just a little bit bigger, deeper, scraping the infection out. Or okay, if a gum disease surgery is needed, let's do it, because not doing it is keeping that rotten chicken under the carpet, and then wonder why it completely stinks up the whole house and people get sick from it.
Yeah, that's right. When people come in and they say they're concerned about bad breath, that's the first thing we talk about, and most of them have, as you like to call it, the chicken under the rug, and once the chicken's cleaned out of there and everything's scrubbed down and disinfected, it goes away. But you don't even need to have surgery in a lot of these cases, because so much of it can be done routinely and just, that first step, and there's a lot more that can be done than that. It's that, it's not a matter of, doing something terribly major on the person to turn it around. Sometimes it's just, like you said, a deep cleaning, maybe just an extra visit. Sometimes we use our lasers, and the laser can be used the same way they use laser on the face to get rid of a wrinkle. You can get rid of the puffiness in the gum and the pocket that's in the gum with the laser, and it's a simple, you don't have to be numb for it. You don't even need anesthetic. It's just a little bit of work on it, and 20 minutes, an extra half hour, a second visit, and you're right back on track. Or sometimes we put an antibiotic down where there might be a really deep pocket in the bone, and there might be a little area where bacteria is building up, kind of like in in your backyard. You have the whole backyard drains, but there's that one spot on the grass that after the rain, if you go out there, it gets a little slushy there because it's a little low, and you got to build that up. Well, it's the same thing in the mouth, and if we put a little antibiotics down into that area there, that one area, the body will heal it up on its own once it's given a chance, and everything will be back to normal again. So there's lots of easy things that could be done. The big thing is get to the dentist. The big thing is get in there and let somebody evaluate what you have and listen to what he's saying and have him explain it to you, and just turn it around, and you'll be healthy. And like all the predictions, we'll all live to be 100 plus, and we'll be healthy. Why not?
Yeah, because, I didn't come out of a university with all those studies, but, there is material out there. And, for instance, here in California, where we both live, there was, I think, the first, and so far the only, stillborn baby found
That's right.
tissue in the placenta.
You were right.
Yeah?
You're right. That's right. The bacteria across the barrier, and there was a stillbirth because of it. You're right.
Right. Or the guy in Japan from a university who... the professor who researched that people who have the HIV virus, which is not yet AIDS, but does turn into AIDS if your immune system is low, people with gum disease much, much faster got the AIDS full-blown rather than just the HIV virus, like that basketball player. He has the HIV virus, but not the AIDS, because he probably has a damn good immune system. You know what I'm saying?
Yeah, that's right. And probably getting his teeth cleaned every 3 months, too.
Probably. You know what I mean?
Why not?
Who wants to be bitten by him